Hello, my name is Estee Sneed and welcome to my head to toe assessment. Please enter. And have you emptied your bladder?
Yes.
Okay, and we'd have the client place on a gown, have a seat. And prior to this assessment, we have obtained vital signs and height and weight. First, I'm going to just start with a general inspection of the head. And we're just going to take a look for any abnormality. I'm just going to feel around and also assess the texture of his hair, hair distribution. And also, we'll go ahead at this time and palpate the temporomandibular joint. Can you, and also, we'll go ahead and palpate sinuses for any tenderness or fluid accumulation. Any tenderness? Okay, very good. All right, and so now we'll go ahead and start with our eye assessment. Sorry, can you, we'll start with the near vision test. Can you hold this in your right hand and cover your left eye with your left hand? And breathe the lowest line that you can possibly.
2843.
Okay, and do it with the opposite side.
2843.
Okay, and then do them together.
2843.
And also, I would have instructed my patient to have had that about 14 inches from him. Very good. Okay, so now we're going to continue our eye examination. First, by checking the pupillary response. We're going to look for the direct and the consensual response. And a lot of times in clinic, you may want to dim the lights. And also, if you could just look up, I'm going to inspect your conjunctiva and sclera. And then just let me know if you need a break. Very good. Okay, that all looked very good. So now I want you to just, we're going to assess this extraocular movement using 6 cardinal gaze. Can you please watch my pen light? And that's without moving your hand. We're looking for any nystagmus. And also let me know if you ever see any double vision or anything during the assessment. Okay, very good. Now we're going to check assess his visual fields using confrontation. And I apologize, I'm going to put my back to you and get about 2 feet in front of the client. And let me know which side you see my fingers in your peripheral vision.
Left, right, left, right, both, both.
Very nice. Okay, so now we're going to continue the eye examination doing the cover-uncover test. We're going to look for any lazy eye, and we're just going to check the alignment of the eye. If you can just get a focal point. Okay, very good. There was no lag or anything. Very good. Okay, so we're going to continue our examination, and also we would use an ophthalmoscope to identify the optic disc and the nerves. However, we do not have the eye vessels, because we do not have an ophthalmoscope. So we're going to continue looking at the nose, checking for midline, any issues, just having you tilt up just a tad. And we're just going to look for any polyps, septal deviation, anything like that. Okay, so now we're going to continue our exam and look in the mouth. I'm going to get a tongue depressor. And I'm going to place that in my dominant hand and the pen light in my non-dominant. Okay, if you can just open up real wide, we're just going to look at all the oral mucosa and also look at the teeth. And look all around. Look for any ulcerations. Okay, also open up real wide. And can you put your tongue to one side of your cheek? Now I want to look just in the back of the tongue. Can you do the other side? That's where those oral cancers do like to hide. And also, we'll go ahead and test, if you can say "ah" for me. Okay, we're looking for that soft palate to rise. And also, stick out your tongue. One, good. Okay, that's good. All right. Now we're going to continue our examination doing the ears. And we'll also continue some of those, some assessment that we will do with the cranial nerve, and we'll also kind of go back and discuss some of these that we've just done. Okay, so we're just going to take a quick inspection of the ear and the outer ear. Just take a look for any cerumen. We're looking for symmetry, as we did with the eyes. And we're going to palpate. And any tenderness. And this is the time that we would have used the otoscope to check our tympanic membrane, looking for any redness, bulging, traction. However, we do not have one once again for this assessment. So now we're going to go ahead and continue doing the Weber test. I'm going to strike this tuning fork and put it on place on top of your head, and let me know if you hear it in your right, left ear, or both.
Both.
Very good. We're going to continue testing the hearing, doing the Renee test. I'm going to strike the tuning fork, place it on your mastoid bone right behind your ear. Then let me know when you stop feeling the vibration, and then we're going to put the tuning fork in front of your ear and let me know when you stop hearing the sound. And I'm also going to take note of the time that it takes. We want to make sure that both sides are equal.
Okay.
And that air conduction is twice as long as bone conduction in both ears.
Okay.
Okay, very good. We're going to do it the same and same thing on the other ear.
Okay. Okay.
Okay, very good. Now we're going to continue. We're going to do the whisper test. I'm going to get behind the client. And if you can cover up your right ear.
Apple.
Very good. Do the other side.
Baseball.
Very good. So that would continue our ear examination. Now we're going to look at the neck. First, we're going to just inspect it. I'm going to check for the trachea, make sure it's midline, and it is. That's excellent. And then we're going to just palpate thyroid, 2 lobes. And if I suspected a mass, I would come behind the client and have him have just a sip of water. And hold that in your mouth, please. And then I'm going to come behind the client, palpating the tube, trying to palpate the lobes, and have a swallow. Very good. And for this, to continue the neck examination, we'll go ahead and do the lymph nodes. We're going to do the posterior cervical chain in a circular motion with the pads of my fingers, the occipital lobes, the postauricular, preauricular, anterior cervical chain, infraclavicular, supraclavicular nose, right there. And we're going to do the submental and the submandibular. Good. And while we're checking our lymph nodes, I'll go ahead and check the infraclavicular on both sides and the axillary. I'm trying to be careful because I know it's ticklish. Okay, very good. Alright, and at this point I'm going to go ahead and check his carotid pulse on each side separately. Very good. Okay, now I would just take a quick listen, and we're going to use the bell of our stethoscope to listen for any bruise in the carotid or thyroid. And you may want to have your patient hold their breath for just a second when you listen to the carotid, so you don't get any lungs or any breathing sounds. Okay, very good. Didn't hear anything. Okay, so now we're just gonna take a quick, just inspect the front of his chest, and then we'll go to the back side. Okay, so first we're just gonna feel for any pulsations, thrills, heaves, just any abnormalities. And while I'm doing this, I'm going to go ahead and feel for the point of maximal impulse. Okay, very good. Okay, and while I'm already touching him, I'll go ahead and check for tactile firmitis on the front side. And you just say 99 when I touch you.
99, 99, 99, 99, 99, 99, 99, 99.
Very good. And we would do the very same thing on the back side. So we'll go ahead and start with percussion. And you should hear a nice resonant sound. Oh, excuse me. Every now and again, if you get a dull sound, you may just be on a rib, so you would just reassess that area. Okay, and then we would do the lateral side. Okay, and we'll do the same thing on the back side. And we'll go ahead and listen to the front, and then we'll finish up on the back side, just for the video's sake. Just take a listen. First, let's listen to the lungs. Big deep breath. And out. Big deep breath. And out. We're going to go ahead and listen to that lateral side of the lungs as well. Okay, very good. Also, while I have my stethoscope on, I'm going to go ahead and listen to the heart sound. Start with the aortic area. Tricuspid. Also, we'll listen to the pulmonic and the mitral, which we're listening to now, and Erb's point. And we're just listening for S1 and S2, making sure there's no gallops, clicks, or if there's extra beats or murmurs. If that sounded great. I'm going to have you just turn to the side, if you will. Okay. So we would also do percussion on the back side too. Just the same as we did in the front. Trying to get in between the ribs in the intercostal space. We'll go ahead and get this lateral again. Okay, so now to continue our percussion, we're going to get the diaphragmatic excursion to see how much the diaphragm moves with respiration. You just take a big deep breath in and hold it. And we're just going from the sound of resonance to the dull sound. And we would mark that with a pen. You can breathe now. Alright, so now we're going to finish that. And if you can take a big, deep breath in and out and hold it out. And we'll just go up with that to your resonance. Okay, so we would mark that with a pen and measure that. It appears that it's about 4 to 5 centimeters though, which is normal. You can get 3 to 6, sometimes even just have it more if the person's really well conditioned. Also, while we're back here, we're going to go ahead and percuss and palpate the costovertebral angle. Any tenderness? Any tenderness back there? Very good. Okay, and that should conclude our chest and back. So now we're going to move to the bed, so we can do abdominal assessment. Let me move this computer so that way, and I'll move all my equipment. Just right here. Okay, if you can lay down. Okay, so we're going to do our abdominal assessment, sorry. Okay. First, once again, we'll just start with a general inspection of the abdomen. Look for any distension, bruising, any abnormalities. So we look good here right now. First thing you want to do with the abdominal assessment, though, other than inspect, is go ahead and auscultate and listen. We're going to listen to all 4 quadrants. Listen for any hypoactive or hyperactive or absent vowel sounds. But we're active in all 4 quadrants, which is excellent. Now I'm going to turn my stethoscope to the bell and listen to the aorta and the renal and iliac arteries. We're listening for bruits or any abnormalities. And we're going to listen to the femoral. But generally we'd want to do that without the clothing wear. But for this video purpose, I didn't want to expose him. Okay, so now we're just going to do percuss, and hopefully we'll get a good tympanic sound. And we did, so that's good. So now we're just going to percuss up on the right mid clavicular line, and we're going to try to percuss the liver. And there it is. When you start to hear that dull sound, that's when you have the liver there. Okay? And also, if you could turn to your side with your left side up, and we're gonna try to percuss for the spleen. Just due to the bed arrangement here, that's why we're gonna have to. There's a little bit of dullness there. Okay, so go ahead and lay back, and if you can come to the edge of the bed just a tad. I'm sorry, a little bit short. If you lay back. Yeah.
Sorry.
Well, it's okay. All right, so now we're just going to do a palpation. We're going to feel for the liver borders and try to see if the spleen's palpable or not, and hopefully it's not. And so we're just going to go right up underneath that rib area there, and it is smooth, and that's the liver because we're on the right side. Now we'll go to the left side. Try to feel for that spleen, and which we hope is non-palpable, because if it is, it means that spleen's probably enlarged, and that would not be a good thing. Okay, so now we'll just start with the general light palpation of the abdomen. Just feeling for any abnormalities, pulsations of the aorta, or any of the arteries, main arteries there. Okay, so now we're going to go to a deep palpation. Look for any masses, tenderness. Do you have any tenderness there? Very good. Okay, so that should conclude our abdominal assessment. So if you'd like to go ahead and sit up. Sorry. I know these are not the ideal conditions for a clinic. If you can scoot just so we can have the computer there. Thank you. Okay, so if you can raise your arms out straight. We're going to test your muscle pressure. And just hold your arms in place. I'm going to press down. Good. Very good. All right, and start grips in my hand. Very good. And do the same with your feet. You can rest your arms out. Feet, and press down. Very good. You can go down now. Okay, so we'll go ahead and test, feel for the brachial and radial pulses. And since we're checking the pulses, we'll check the popliteal. The posterior tibial, which is just posterior to the ankle right there on the inner side, which I know you can't see, so I apologize. And then dorsalis pedis right on top of the foot. Okay. So now also while we were doing this, we were inspecting the skin of the arms and legs, and we also would have looked at our skin at our nail beds and checked our capillary refill, which were all good. And now we'll go ahead and do our reflexes. You just relax your arm as much as possible. We'll do the brachial. Just relax the arm as much as possible. We're just looking for a twitch in the thumb or hand. Okay, good. Okay, and if the height was a little bit better, of course, we're going to try to have him just kind of get his leg up and relax as much as possible. We're going to just strike right below the patellar bone there, the kneecap. And he did have a little slight movement. And then also we'll do the Achilles tendon, which would be on the posterior aspect of the ankle. Look for a little twitch. Just striking those tendons. See about that deep those reflexes. Sorry, did I get you? Okay. Now we're just going to just make sure that we went over all the cranial nerves at this point. Oh, excuse me. Also, we'll go ahead and do our cervical and spinal, lumbar spine assessment. Can you extend your head all the way back and flex it forward? Put your ear to your chin. I mean, not to your chin, excuse me, your ear to your shoulder, and the other side. Very good, very good. Okay, then I would have you stand up and just reach forward, turn towards me so I can check your, okay, yeah. And then reach forward and try to touch your toes. And I'll just be checking the spinal alignment. And if you had any tenderness during that. If you can go ahead and have a seat again. Also, if I were suspecting a herniated disc or any type of lumbar or spinal injury that was causing pain, like especially shooting down the leg, could it be indicative of some kind of type of nerve pain? I would have this patient laying back, and I would pick up his leg, each leg individually, and see if that elicited any pain, and that could indicate a lumbar or nerve injury. All right. Also, so at this point, we're going to go over all the cranial nerves and make sure that we have assessed them all fully. First, the first cranial nerve is the olfactory nerve. And we don't generally test that, especially when the patient has not had a complaint of decreased sense of smell. So we're not worried about that at this time. Cranial nerve 2, the optic nerve, we did check that already with the vision, with the Rosenbaum. Cranial nerves 3, 4, and 6, we tested with the extraocular motor movement of the eye. Cranial nerve 5, we'll just go over it once more. Can you clench your teeth? And move your jaw side to side. Very good. Very good. Okay, so now we're also going to test for sensation. Okay, you tell me if it's sharp, and close your eyes, and tell me if it's sharp or soft.
Short. Soft. Sharp.
Sorry.
Soft.
Very good. Very good. Okay, so cranial nerve 7. This is the facial nerve, and so we're going to go ahead and puff your cheeks, smile real big, close your eyes real tight, and that's good. Very good. Because we're not going to test the sensory function of the facial nerve because he has no decrease of sense of taste, and also his motor movements are all intact. Cranial nerve 8, the acoustic would be, we've already checked the hearing with the Weber and Renee test and the whisper voice test. Cranial nerves 9 and 10, we did test, but we'll go ahead and test them again just for good measure. Can you stick out your tongue and say ah? Very good. And swallow. Okay. So we're not going to elicit his gag reflex because he can swallow, and his tongue was midline. Cranial nerve 11. I would like for you now to try to turn your head towards my hand there. I'm going to hold a little resistance there. And the other side. Very good. And do a shoulder shrug for me. Very good. Okay, so cranial nerve 12. Which also we tested when he stuck out his tongue. And it was midline, but we're going to go ahead and just finish it off with him saying light, tight, and dynamite.
Light, tight, and dynamite.
Very good. And that should conclude our assessment for today. Thank you for your time.